Welcome to another tutor short provided by the Educational Support Services Department of Lehigh Carbon Community College in Snexville, Pennsylvania, which is just outside of Allentown. These videos review key learnings for the science courses provided here at L-Tri-C. And please remember that the Educational Support Services Department does provide walk-in tutoring 5 days a week.
In this view, you can see the two coxal bones, also known as the hip bones. Part of the coxal bone is the ilium, located here, the ischium, which is located down here, and the pubic bone, located here. The two coxal bones, along with the sacrum and the coccyx, form the pelvic girdle. Here you can see your iliac crest and the SI joint, known as the sacroiliac joints. You can also see the anterior superior iliac spine, as well as the pubic tubercles, located here. In this view, you can see the pelvic brim, which is also known as the pelvic inlet. That is located here. In this view, you can see the ischium, as well as the obturator foramen. A foramen is a hole. Again, the SI joints, and the sacrum. The superior and the inferior pubic rami. This is the superior, and this is the inferior. You can see the ischial ramus, located here, and again, the pubic tubercle. Here's the pubic symphysis, located in the center. In this view, you can see a comparison between the female and the male pelvis. For the females, you can see that the cavity of the true pelvis is broad and shallow, whereas in the males, it's narrow and deeper. Also, the bone of the female pelvis is less thick. The pubic angle is broad in the females and rounded, whereas in the males, it's more acute and angulated. This is an anterior and a posterior view of the coxal bone. In the posterior view, you can see the acetabulum here, which is where the head of the femur articulates. You can see the pubic tubercle here, and the ischial ramus, located here. You can see the lesser sciatic notch and the greater sciatic notch. In between them is the ischial spine. You can see the posterior inferior iliac spine and the posterior superior iliac spine. This area here is known as the iliac fossa. In this view, you can see the various articulations of the pelvic girdle. Here you can see where the femur articulates with the hip bone at the acetabulum. Following this down, you can see distally that the tibia articulates with the femur to form the knee joint. Distally to that, the tibia articulates with the talus bone to form the ankle joint. This joint is stabilized laterally by the fibula. Here is an anterior and a posterior view of the femur, which is the largest and longest bone of the body. Here you can see the head of the femur. You can see the trochanteric line. You can see the lateral epicondyle and the medial epicondyle, as well as the patellar surface, where the patella sits. You can see the greater trochanter and the lesser trochanter and the neck of the femur. You can also see the intertrochanteric crest, as well as the linea aspera. You can see the medial condyle and the lateral condyle, as well as the intercondylar fossa. In this view, you can see the anterior and posterior view of both the left and the right femurs. This view is given so you can tell the differences between the left and the right. In the anatomical position, note where the neck is. At this angle, you can see why the neck is the weakest part of the femur and is often fractured. In this view, you can see the tibia along with the fibula. This is a view of the right lower limb. On the proximal portion of the tibia, you can see the lateral condyle and the medial condyle. You can also see the tibial tuberosity, as well as the head of the fibula. Distally, you can see the medial malleolus, the fibular notch, as well as the lateral malleolus. This view is given so you can tell the difference between the anterior and the posterior view of the tibia. As you can see, this is a right anterior view of the tibia. Note the medial malleolus. This is a view of the fibula. Here you can see the head of the fibula and the lateral malleolus of the fibula. The lateral malleolus portion stabilizes the lateral aspect of the ankle. Here's a view of the bones of the foot. In this view, you can see the talus, you can see the navicular, the medial cuneiform, the intermediate cuneiform, and the lateral cuneiform. You can see the cuboid and the calcaneus. These 7 bones I have just named are known as the tarsals. Distally to them, you can see metatarsals 1 through 5. Along with phalanges 1 through 5. You have the proximal phalanges, the middle phalanges, and the distal phalanges. Thanks for watching. To view these models, or if you have any questions, please come to SH 150 in the Educational Support Services Center.